Senator Tom Cotton facing constituents in Arkansas last month. It happened to a number of senators. Republicans got an earful from voters at home. Many worried they'll lose Obamacare coverage. Others worried they're stuck with it and the high premiums that have come with it. A revised health care bill now heads to the Senate, where Senate members say there are a lot of changes to come. Louise Radnofsky, White House reporter at the Wall Street Journal, joins us now. Nice to see you. Big picture here. You do get a sense this is going to be a lot harder in the Senate than it was in the House.
It's certainly going to be harder. The margin of error is even slimmer in the Senate than it was for House members. You can't afford to lose more than 2 senators in the GOP caucus, assuming no Democrats vote for it. There are at least 3 GOP senators on both sides of the party spectrum who've said they want things that are irreconcilably different from what the other side wants.
Well, and you think about sort of the true diehard conservatives in this, Lee, Cruz, and Rand Paul, who basically said, not a chance.
Right, and they're not even necessarily united with each other either. Rand Paul's kind of out there on his own, so everybody has to figure out which one is up with the 3 of them.
How much political capital does the White House really have to spend on this, or did they spend it all in the House?
They certainly say they're going to be very engaged with the Senate. They say that people didn't think they could get it done in the House the second time around, that they were crazy for doubling down and going back. They think they can apply the same sort of magic that they managed to eke out a House win with to the Senate.
Was this White House magic, or was this Paul Ryan magic?
You know, if you watched the Rose Garden ceremony on Thursday, everyone was lavishing praise on each other and crediting each other. There was certainly, if anything, a couple of weeks in which members went back to their districts, Republican members who had run on this for 3 straight elections and felt from their constituents like whatever happened, they had to at least get something out of the House to say they'd done their job. That was probably the real magic.
We have a lot of folks here who have a lot of history covering the White House and Capitol Hill, as you do, and I don't know if anybody could remember the last time there was a ceremony in the Rose Garden after a bill passed one chamber.
It was certainly a victory lap. On the other hand, getting that bill through the House against all the odds could quite reasonably be seen as a considerable victory against the odds for this White House.
Well, so certainly they want to play it that way. Is there a danger, or was there a calculus if there's a danger in having a moment like this, especially if all of a sudden it fails in the Senate?
Well, they certainly said there that they expected the Senate to act, but it did also leave potentially the impression that getting through the House was the only thing that was going to happen with this. This was going to be the great shining moment for their effort.
Yeah, well, it cuts both ways. After this, especially after it passed, we saw these sort of insane talking points from both sides really come out. If you listen to Democrats, if you've ever stubbed your toe, you're not going to be able to get health care. If you listen to Republicans, even listen to the president, hey, look, premiums are going to come down, pre-existing conditions are going to be covered, deductibles are going to come down, and more importantly, as he said, it's going to be great. You get the sense that neither side's really telling you the full deal here.
Well, health policy is confusing and complicated, and that leaves a lot of room for exploitation and partisanship as both sides wrestle with the facts. There are arguments that each side can make for their case. What Americans are ultimately wrestling with is this difference between whether you want lower premiums, which you could have, or whether you want to cover everyone regardless of their medical history, which you could also have. But having both of those things at the same time is really hard, and Americans have never been asked to choose which one they want.
That's what politicians do. They promise you things that you can't have. Happens all the time. The question, though, for the White House right now is really how far can we push in the Senate to get this through? What cookies are on the table right now?
Well, the White House knows that there are going to have to be changes in the Senate. They don't necessarily think that the Senate is going to be rewriting it, perhaps as aggressively as senators themselves think they do. But they know that Medicaid is on the table, because it's the kind of statewide issue that senators in particular have to wrestle with. They also know that tax credits and the way they're structured in this new Republican bill are on the table. So both of them are going to be things that occupy everybody for the next few weeks, months, however long they're going at this.
How worried is the White House about the sound bites that are being created by the president of pre-existing conditions will be covered? You will have lower deductibles. You will have lower premiums. When we don't have the CBO scoring, and really, as we learned from Obamacare, there's a law of unintended consequences when it comes to health care legislation.
Certainly, the last administration did learn towards the end that some of the promises that the President Obama had made at the beginning were very hard to live up to at the end. But they also saw those as necessary things that needed to be said at the time to get the bill passed. In some ways, you fight the battle that's immediately in front of you, and you worry about the later battle later.
And this White House seems okay with that philosophy as well.
So far for now.
All right. Well, we'll read about your reporting in the Journal and what you have to say about it. Thanks.